provided an outline of the country's vaccine rollout strategy yesterday. Now, the minister said healthcare workers will be prioritized in the vaccine rollout, followed by the elderly and those with comorbidities. But for a reaction on this, I'm joined by Mr. Zola Sapeta. He is the General Secretary of the National Education, Health and Allied Workers Union, NAHAWU. A very good afternoon to you, sir, and thank you for your time today. Now, we've heard the Minister of Health giving a national address on the plans for the COVID-19 vaccine. What is your reaction as NAHAWU regarding the details and the meat of what he actually presented?
Good afternoon, Tammy, to you and your viewers. We do note the efforts. However, we're a bit disappointed because our government was caught napping, precisely because we don't feel like we have been part of the G20, neither of the BRICS. We did not take an advantage of those countries now that they've produced this to our advantage, including the fact that there are 40 countries and some of them are from Africa that have been in the pipeline, and South Africa is still negotiating at this point in time.
We did hear the minister saying that he hopes that February will be the month for the rollout, but he also made it very clear that, as he says, this is really more of our wish and the fact that there are no concrete deals that have been signed. What do you make of this, and what could be the possible reasons? We all knew that we are in the midst of a COVID-19 and the fact that vaccines would be available shortly.
You know, hopes are just hopes, but the reality is concrete. We should be by now knowing concretely in terms of where are we, when are we to get the first set of distribution, so that we can then give priority to frontline workers. The fact that is not promising anything is quite disappointing, and we do think that the country is losing hope once again. Because we're talking about South Africa that its president had said in the first quarter, now says in the second quarter. And that we do think that it would have boosted us if really were concrete. But what can we say? We will remain to hopes that this will happen, and we are looking forward to engage with him as he promised us on the 30th, that he will have to meet with us once dates are clear, so that we can discuss the distribution to frontline workers. As you know, that people are infected now and are dying now. We need this vaccine as soon as yesterday.
Now, we do know that COVAX has been pointed out as perhaps one of the vaccines that can be used before the official vaccine becomes available. Does it matter which type of vaccine healthcare workers get, or indeed South Africans get, in your opinion?
Yes, it's important that, of course, we know vaccines are not 100% guaranteed, but if they have been proven scientifically elsewhere, why can't we get them? So that we deal with the challenge that we are confronted with currently, and as we deal with the perfect forms of vaccine. But for now, we are so desperate. We do think that we must take an advantage of our relations with China and Russia, and they have those in addition to this, because 10% is a little of population is a little number, really.
Now, we are aware that 1.25 million of the frontline workers are first in line to be getting the vaccine when it does become available. But if you could give us an update as to what is the true nature of the status quo of frontline workers dealing with COVID-19, specifically in this period of a second wave.
As we said, the first thing is an anxiety general, which impact negative to their attitude and their commitment to triple their efforts. And the fact that they don't feel prioritized, because even today we are still talking about issues of PPEs, matters that we would have raised them as late as March last year. Even today we're still talking about after 9 months. So generally, if the government has no hope, what more? To frontline workers, but they are soldiering on. They are trying their best to save the nation, but we do think that government must do its best to ensure that the priority is given to the frontline workers. It's one thing to say they will be prioritized, but we know South Africa, some who are using their positions in government, they might even steal these vaccines and will have to run into trouble, given the fact that it's going to be centralized. Potentially in a country that is highly characterized by corruption, anything is possible. So we are looking forward to meet and then concretize measures, because currently things are ambiguous, are not clear at all.
Are you then saying that you are not in agreement with the one procurement approach that government is taking?
We are. We know we have been advocating for that, but we cannot take away the fact that looters are at the center of government. That's why workers have not been paid their money, because their money ought to be redirected, because people are looting in the state.
Do you as Nahawo feel that you actually have a role, an impactful role to play in the rollout process as far as negotiations with government and touching base with the powers that be?
Certainly, as you will know, that we have been contributing since the 5th of March. We have tabled the recommendations for considerations. And last week in the meeting with the department, we had agreed that we must strengthen the weaknesses of their resurgence plan. And we do think that once you talk about frontline workers, you're talking about us. So you can't talk about us without us. It's important that you must involve us in terms of the plan and the distribution. By the way, COVID-19 is a societal issue, so every role player and a contributor is needed in this fight.
There's some elements of the COVID-19 rollout plan that have been highlighted as being quite ambiguous right now and perhaps not even tackled by the Minister of Health. And one of those aspects is the issue of storage and the distribution of the vaccines. What is your interest in that? What contribution can you make regarding how that can be done and achieved?
We do think that the first thing that we must do, such a kind of an arrangement should be linked into phases first. We don't have to discuss them in isolation. As you will know, that there's a three-phase prong approach. That's why we then, we need to meet with the minister. We don't have to wait the vaccine to arrive. We must be concrete in terms of the plans now, so that as and when the vaccine comes, we are ready. Because one of the issues that we're worried about is the whole issue of governance and leadership in hospitals, and the institutional plans as and when these vaccines will be needed. Those are the critical issues. We think that they must also be brought to the fore while awaiting for the vaccine at the level of strengthening the strategy, so that by the time we receive the vaccine, we are not planning.
All right. Well, thank you very much for your input and your time this afternoon, Mr. Sapeta. That's Zola Sapeta there from Nahawo.